So I'd like to talk briefly about Tourette Syndrome. What is it? How do we diagnose it? Really, the hallmark of Tourette Syndrome is the tic. It's spelled T-I-C. A tic really is an involuntary movement. In other words, the child has no control over. And it can take various forms. It can take the form of a simple muscle twitch, eye blinking, unusual facial expressions, and some unusual things like coughing, throat clearing, and even sometimes saying words underneath your breath. So it is a repeated involuntary movement that actually is quite common in childhood. Tics occur commonly and typically are self-limited. So we always tell parents if a tic starts, really basically just ignore it, because most children after a couple of months will lose that tic. Tourette syndrome is a little bit different in that it always has vocal tics. And again, vocal tics are throat clearing, coughing, speaking. And Tourette syndrome, of course, is famous for saying some rather colorful and annoying words under your breath. That particular symptom only occurs in about half of the patients, so you can't go by that. But the tics certainly can be an issue, but the real issue generally is other things. And the other things include attention deficit disorder, with trouble concentrating, trouble performing in school, trouble doing homework is probably the most common thing, but also anxiety is extremely common, and sometimes depression. So the other symptoms usually are the ones that we have to manage the most, and occasionally we do have to help the tics. There is medication available now for treatment of the tics and of course of the attention deficit. So to make the diagnosis of Tourette's, though, these symptoms have to be present for more than 3 months. And again, you have to have vocal tics to make the diagnosis of Tourette syndrome. Of interest is Tourette syndrome is common. It occurs in about 1% of the population, so making it really about the same frequency as autism. So it's a very common disorder and certainly worthy of consideration if you have a child who has a tic with some other associated problems.